Trevor, hey Trevor, you ready to make a video? Okay, here we go. Alright. I'm gonna do the shoulder muscles that we haven't covered yet. Latissimus, Dorsi, Teres major, Pec major. Okay, remember the Latissimus originates from the lower thoracic all the way down to the sacrum. Iliac crest comes up and goes under to insert into the front of the proximal humeral head. And I'll show you that on the skeleton. So here it is, right here. It is an extensor of the glenohumeral joint. It is a shoulder internal rotator. So if we did this, you can see the lat kicking on. It is, here it is right there, an adductor. Okay, so I'm going to resist it doing extension. Okay, I'm going to apply my resistance no further than the middle of the humerus into flexion. Okay, so Deb, I want you to just lift your arm up like that. Keep your palm like that. Is that okay? All right. First time, no resistance. Go ahead. There it is. Second time, a little bit of resistance. Okay, relax. Third time, more resistance. If I wanted to resist it as an internal rotator, again, there you can see it right there, okay, coming up. This is internal rotation. Now I'm going to just use my Girl Scout fingers. You can't really see. Well, there we go. My Girl Scout fingers. Go ahead and do this motion. Go ahead. Go ahead. So you can see how I'm applying the resistance. Now I'm going to move the camera closer so that you can actually see the muscle activate. Go ahead and do that motion. There it is. Again. Go ahead, good. Now the teres major is the little helper of the latissimus. Put your hand behind your back. Inferior angle, okay, relax. Inferior angle of scapula. It originates right near that inferior angle, comes along the lateral border, but then dives in to go to the front of the humerus. I'll show you with the TheraBand. I could resist the same three motions. It's the little helper of the lat. So we could do, hold on, extension. Go ahead, and I'm going to put my finger right near that inferior angle. I could resist internal rotation. Go ahead, internal rotation. I could resist adduction. Okay, go ahead and do that motion. So any of those three motions. Latissimus dorsi is the thoracodorsal nerve. I'm going to let you look up the nerve roots. And the teres major is the subscapular nerve. This trip, you're going to look up the nerve roots. Okay? Flip over onto your back. Pectoralis major. Okay? Pec originates on the clavicle. The sternum comes up to the proximal anterior head of the humerus, the lateral lip of that bicipital groove. So it does everything except horizontal abduction, and it can't externally rotate. Okay? So I'm going to resist it doing its best action, which is horizontal adduction. So you're going to pull across like that. I'm going to put my hand right on the chest. I'm going to resist right here. So the first time, no resistance. Go ahead, pull over. Good. The second time, a little. Go ahead, pull over. Good. The third time, and I'm listening to my fingers. One more time. Perfect. Pectoralis major, medial and lateral pectoral nerve. Now, let's see what else this muscle does. Does it internally rotate? Go ahead and do that motion, and there it is. You can see it. So, yes. Is it an adductor? Go ahead and do that motion, and yeah, it is. Good, good. Is it a flexor? Well, the clavicular portion is going to flex to 90 degrees. So if I put my fingers, and I'll show you where they are, right there on that clavicular portion. Go ahead, Deb, lift up. I can feel it right under my fingertips. And is it an extensor? This is the only one that can be a flexor and an extensor. The sternal portion can extend to 90. Okay, so go ahead and do that motion, and sure enough, I feel it firing. So it's a flexor to 90. It's an extensor from full flexion back to 90. But go ahead and practice feeling the muscle. It's very superficial. Now, is it an abductor? Okay, not that well. It can help initiate abduction. So if Deb brings her arm out to the side, but then all of a sudden it shuts off. I can't feel anything. Okay? Pectoralis major, medial and lateral pectoral nerves. Now we're done with the glenohumeral joint.